Good afternoon. I'm Dr. Noelle Bissell, the Director of the New River Health District. Today is October 16th, and I'm going to give you a brief update on the COVID-19 situation in our area. Keep sending us your questions and concerns. If you have questions, so do other residents. Our answers are posted on the NRV Road to Wellness webpage where you submitted the questions. We have been at low-level community spread in the New River Valley, and we can continue there if everyone is careful to wear a mask, watch your distance, and wash your hands. However, it's likely that we will see clusters, and we may see some spikes in cases, just like when the students returned in both Bradford and Montgomery County. This week, for example, we are experiencing a workplace outbreak, and we will see a rise in cases of COVID-19. We are working with all parties to contain it, and of course, in conducting our case investigations and our contact tracing. Workplace outbreaks have not been a huge part of the COVID story so far in the New River Valley, despite numerous such outbreaks in surrounding regions. We'd like to keep it that way. We encourage people to adhere to prevention measures at work as well as in social settings. I'd like to remind you that congregating in the break room, meeting in conference rooms, or sharing car rides require the same masking and physical distancing practices as the rest of the workplace. The masking is especially important when distancing can't reliably be done. We know how to beat this disease with masks, distance, and soap or sanitizer. However, while many people are following protocols in their workplaces and professional roles, some are more relaxed in their personal lives. If you consistently wear your mask, watch your distance, and wash your hands, whether you're at work, at school, or relaxing and socializing, your chance of contracting COVID-19 is very low. If you do get a positive COVID test, it's reported to the Virginia Department of Health. We have a double reporting requirement. Your medical provider, or whoever did the test, is required to report the case with your contact information, and so is the lab that processed your test. Once we are notified, we will contact you within 24 hours. If you aren't contacted by us within 24 hours, please call 540-267-8240. That's 540-267-8240. Please remember that the reporting may have some lags due to these different reporting structures. Case investigation and contact tracing are powerful tools that public health has used for decades to contain and mitigate the spread of communicable diseases such as sexually transmitted infections, pertussis, meningitis, hepatitis A, B, and C, Lyme, West Nile virus, and even Ebola. Speaking of other diseases, we have 2 weeks left to get our community fully vaccinated against flu by the end of October. Flu has hit our area, and the Roanoke Valley even had a patient who tested positive for both COVID and flu. We don't want to be fighting both a flu epidemic and the COVID pandemic. Thank you for your continued support and patience as the pandemic continues. We have to remain vigilant. Remember to stay informed, to watch your distance, wear your mask, wash your hands, and don't touch your face. Thank you.